Hello everybody, hope you had a great weekend. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. We are going to go over tonight post-COVID symptoms. As always, I say a lot of things that I talk about come up in the clinic, questions I get asked, and feedback in general. And I've been getting quite a few emails. I put up a blog post about it, and I've been getting quite a few emails about what is post-COVID symptoms. Should you be concerned? And this is really obviously a new area for everyone since COVID just came to light last year. And we are seeing everything from shortness of breath to joint pain. So you really have to pay attention. It's not something that you want to ignore. It's not something you want to power through. And the difficulty really lies in the fact that it doesn't matter if you had a severe case of COVID, if you had COVID and didn't have any symptoms. A lot of people are showing symptoms post-COVID, whether they were sick and in bed or in the hospital, or whether they were up walking around and had no idea that they even had it. They just got tested because somebody in their house had it. So let's talk about some of the things that are becoming more and more common, are showing up in the research. One of the most prevalent things about what we're seeing with post-COVID symptoms is shortness of breath, lung damage, some sort of fatigue. And there are several studies out right now that are showing that even if you had no symptoms whatsoever, they're showing severe lung damage in some cases. They're equating it to smokers' lungs and things like that. So you can really wind up having some shortness of breath issues, fatigue, difficulty going up the steps, difficulty returning to working out, problems with walking, just kind of being more sleepy during the day. Because obviously if your lungs are not able to put out the amount of oxygen that your body needs, you are going to have all of those issues. So again, I can't stress enough, there is no correlation between how severe your symptoms were and how severe they are after. It really has no bearing. I know people who were the sickest that you could be have recovered and they feel fine. I know people who have walked around with nothing and just tested positive because a family member did and now are experiencing symptoms. This is months later also that we're talking about. This is not like, okay, I'm negative, now I'm getting a lot of these symptoms. You can have these symptoms months and months after you've had COVID. So it's one of those things that because it's not well researched, it's not well talked about, it's brand new, people aren't real sure on what to expect, on what to do. So we talked about the shortness of breath, the fatigue, the weakness. We're seeing lots of increases in joint inflammation, meaning maybe you felt arthritic before, but now after COVID, your joints really are aching. You're finding maybe it hard to do fine motor skills, like hold a coffee cup, write your name, just because overall you've noticed some joint stiffness. This is completely normal and what we're seeing with post-COVID. Again, this may have been a little bit before, but those post-COVID symptoms have increased that pain. We're also seeing a lot of muscle soreness, and I'm not sure that that's not related to the lungs, but almost like I worked out type of soreness in your muscles that doesn't really go away, but just that overall fatigue that we're seeing come into light. Back pain is another post-COVID symptom. Now, we have a whole video, if you go on our YouTube channel, that specifically talks about COVID back pain, but we're seeing more and more back pain from COVID that either is, again, was there previously, but now is exacerbated and is not quitting, but having difficulty sitting because of back pain. You're being woken up because of back pain. We're also getting reports of headaches and increases in headaches post-COVID, during COVID. Again, that could be just more of a posture-related issue. We're seeing just a lot of trends from this post-COVID symptoms that are relating back to muscles that are relating back to weakness and fatigue. And it's not something you want to ignore, because if there is a inherent underlying issue going on that you suffer during COVID, especially if there's lung damage, you're not going to be able to kind of push through and get back to where you were. It's something you really want to make sure that you're easing into, and it is something that you really want to consult a professional for, because you don't want to hurt yourself worse because you had COVID. So those are a couple of the symptoms that we're seeing and we're winding up treating because of COVID having happened. If you or someone you know is suffering from COVID or had COVID and is interested in some post-COVID recovery, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in for a free consultation. Thanks and have a good night.